Welcome back. This is the Intel on ENCA. Well, she is known for taking a hard stance on COVID-19, rightly so. Limpopo Health MEC Phophi Ramathuba wants anti-vaxxers to be denied access to alcohol. She will clarify what she means by that, if that's what she means. Well, she joins us now live from Limpopo via Zoom. She's our profile interview, the Intel briefing here. MEC, thank you for your time. So, you know, this is one of those opportunities we take to sort of understand the personality behind the story, right? You've been part of the coordinated response to COVID-19 since the outbreak began last year. And we've come to know you on our screens, but we don't really know the person behind the title of MEC. So just as a start then, how would what is the content of the answer to the question, who is Phophi Ramathuba?
Phophi Ramathuba is a health activist, a mother, of course a politician. I wouldn't be an MEC. But most importantly, it's someone who is passionate and caring about life, because I do understand that what the health of the nation means. If we don't have a healthy nation, we will not be able to achieve anything. I think COVID-19 has shown us that when you have a pandemic outbreak, your economy shut down, everything, schools, there's no single activity, social gatherings. So it tells you that unless we become very serious in terms of making sure that the health of the nation becomes our priority, all the ambitions and the dream of growing South Africa to be a better country would remain a dream. But if we have a healthy nation and we have people who are healthy, then you'll be able to grow your economy. You'll be able to attract investors. Your education will also flourish. And I mean, quite everything that the determinants of health are linked with all these issues that I'm raising, the social ills. So for us to focus on the health of the nation, dealing with the social ills, we will be able to have a beautiful country. So that's who I am. I live for the health of the nation.
I find it interesting that the very first word you used in describing yourself is activist. And I imagine that, there's a reason for that, because being an activist is not something that you choose. It almost chooses you. You have these causes that you care about enough to do something about. So just talk to me then about how your work as a doctor and now in leading the health department has enabled you to channel that activism towards which specific, goals and objectives.
I think the activism, you can locate it back from my student life. Probably that's where the passion started, where you have students from the poor background being excluded because they cannot afford the fees. When you have students who can't afford a meal card. And from that young age, you are then forced to share your meal card with fellow students. You must negotiate for them not to be excluded financially because they are performing academically. You are sharing your room with students that you don't even know where they are coming from. They are first-year students from the deep rural villages of KZN. They come to Gauteng, to Pretoria. At that time, SMU Medusa was Medusa. You have to accommodate them. So it starts there, and you start to feel for others, and you want to see yourself saving. So even when one graduates as a medical doctor, and the manner where we were being trained by our medical school, we were taken to rural areas. For instance, I remember I did some of my clinical blocks in Sukororo Hospital. I'm fortunate enough and coincidental, I was just in Sukororo a few minutes ago. I'm just on my way back to Pulkwa. Now, you are in this area, there's no cell phone network, there's no charo, there's nothing. They've got only one doctor in that facility. And that doctor, when there's a seizure, he must be an anesthetist, and at the same time, he must be a surgeon and ask nurses to monitor the patient. If the baby come out and things are not going round, it means you must call intervention of Almighty. Now you are forced to be Christians to pray, given the condition at that time. So when you were a student, you were exposed to that. When I became a medical doctor, doing my community service in George Marcel, almost a similar situation as oral. And this is where one took a decision to say, I cannot continue to allow our people to be subjected to this. In my small area where I am, I must make contribution towards the changing and the transforming of this particular system. We've got to get doctors, especially young doctors, to be interested to come back home and serve their rural communities. So from there, being a young doctor at that time, serving in the Junior Doctors Association, also at the same time leading the Young Communist Party at a provincial level, it then exposed you to more and more activism and more wanting to do a lot. And finally being given an opportunity to manage an institution. My decision was to say, I need to show people what a hospital must be, given the very little resources that we have. But for instance, one of the resolutions I took was to say, in my institution where I was a CEO, because I'm a woman, no woman must die because she wants to give birth. I need to appreciate the fact that as a woman, I've been given this position by making sure that fellow women who can't be in this position must benefit by getting quality health care. And I did make that record to say there was no avoidable maternal death under my leadership, which shows that we can still do it. I was able to do it in a small scale, but if you broadly say in all our institutions, we must not have avoidable maternal death, then we will be able to say provincially, then we will go in nationally, then we'll be able to win that. So that's how the activism continue to grow.
You build nicely into my next question. How much of the medical doctor shines through in what Phophi Ramathuba, the politician, the MEC, has to do now? In that, you know, as you were saying now, when you were practicing at various levels, including managing an institution, you could almost quantify the size of your clientele to say, these are my patients. These are the people whose health I'm charged with ensuring. But now it seems to me that you've just gained a whole lot of patients now. Your patients are no longer a couple of hundreds or a few thousands. It's now the entirety of the province. To what extent do you get frustrated by systemic issues that come through as a doctor, but a doctor now who needs to be fixing the situation and the systems for other doctors?
Exactly. The frustrations, of course, because these are systemic, some of them, majority have been inherited and they've been there for quite some time. For instance, when I sit with my executive management, I always say, let's bear in mind that sometimes we are correcting mistakes that have happened for some time ago. The disadvantage is that, you know, I was there as a doctor when some of these mistakes were being committed. When, for instance, let me give an example. You have a staff establishment where you bloated it and appoint so many managers who have got nothing to do with patient care. You create so many directors, chief directors, and then you have a composition of employees taking away 76% of your budget. You are left with 24% to look at medicine, to look at equipment, to look at infrastructure, to also appoint. You don't have the core, because the core business of health is your nurse, your doctor, your radiographer, your cleaner, your porter. Those are the people who you really need, and the rest of your administrators must just support that core. So those things, some of them, I've seen them happen. And the difficulty is that when you're dealing with human resources, it's a sensitive matter. You're dealing with home bodies. You can't just say, now that I'm an MEC and I've seen so and so were appointed, not even meeting the requirements, and their posts were not even relevant. I'm just going to remove all of them. I also come from a union background wherein we've got to look at all these labor issues and try to find a way on how you can amicably address this issue without people having to lose their jobs, without people getting depressed, also coming back to be your patients again. Now, yes, that job. Yes.
I'm sorry, MEC. Let's pause for a moment. I want to take a quick break and we will conclude our conversation in just a moment. That is the Limpopo Health MEC, Dr. Phophi Ramathuba. She is our profile interview here on the Intel on ENCA.